A real-time transcription capture and medical record generation via large language model, um, and also the generation of the diagnosis code and billing code using AI. So I have recorded a conversation between um, physiotherapist and a patient. This is, of course, is not a real conversation. This is kind of we made it up and just for the demo purposes. So I'm going to start the recording, and you will be hearing the conversation. After that, I will be demonstrating how we are generating medical records by just one click, and so as the diagnosis code and billing codes. So let's start recording. This is a virtual visit between physiotherapist Dr. Basak and patient's name is Emma. Good morning, Emma. How are you feeling today? Any update on the knee? Sorry, I have to restart it because the recording was not didn't came up. So let me do that one more time. Start recording, and then let's begin. Today is January 15th, and this is a virtual visit between physiotherapist Dr. Basak and patient's name is Emma. Good morning, Emma. How are you feeling today? Any update on the knee pain?
Morning, Dr. Carter. It's been about the same, maybe a little worse after I went for a longer walk the other day. Stairs are pretty tough too.
That's not uncommon with your condition. Activities like walking uphill or stairs can increase the load on the kneecap. Have you been keeping up with the exercise that we discussed last time?
I have. I've been doing the quad stretches and leg raises, but I'm not sure if I'm doing them right. And I've added a foam roller to help with the tightness in my thighs.
That's great initiative. Let's quickly review your form on the exercise. I will guide you through to ensure that you are activating the right muscles. First, show me your quad stretch. Good effort, but try tucking your pelvis slightly under and engaging your core. That will give you a deeper stretch without putting unnecessary strain on the lower back.
Oh, I see. That does feel better.
Perfect. Now let's move to the leg raises. Do them while lying down, and we'll see how if there is any compensation happening. All right, I noticed you're slightly rotating your hip outward. Let's adjust that. Keep your toes pointing towards the ceiling and your knees straight. Try again.
Like this?
Exactly. Do you feel the difference in how your quad is engaging?
Yes, it's definitely more focused now.
Great work. Remember, quality over quantity is the key. That's also, let's check your patellar tracking. I'll move your kneecap gently to see how you feel. How does it feel? Any discomfort?
A little tender, especially on the outer side.
That is consistent with the lateral tracking issues. The good news is we can work on strengthening your hip abductor and stabilizer to help align the kneecap better. How is your glute strength routine going?
I've been doing the bridges, but I'm not sure about the clamshells. They feel awkward.
Let me demonstrate a modification. You can use a resistant band just above your knees to make them more effective. Let's give it a try now.
Oh, this makes it feel more controlled. I'll keep doing it this way.
Excellent. Consistency is the key. We can end this call today. I have shown you some of the exercises. Please keep it going. Thank you for the visit today.
Thanks, Dr. Carter. I'll stay on top of my exercises.
That's great. Thank you. All right. So this is now processing all the conversation. So you can see like within a couple of seconds, it came up with the conversation. Um, and it provided pretty good um, real-time transcription. Um, then the next thing that we are going to show based on the conversation using large language model, we are generating the medical record. And in this case, we are instructing LLM to use the soft version of the medical record. There are different versions of the medical record exist. So generate medical record, processing the request. All right, so this is what it came up with. The patient name Emma, Dr. Basak. It didn't spell the name wrong a little bit, but maybe because of my saying the pronunciations and so. And then it showed the subjective, objective assessment and the plan, quad stretch, leg raises, patellar tracking assessment, glute strength, etc. It came up with a plan as well. And then the next thing that I am going to do is, based on this conversation, please generate the diagnosis code and the billing codes that we need to submit to the insurance for claims. So this is what provider will be doing with just a button, clicking on a button, and ICD code. It generated M17.9, M25.561, and also generated the CPT code, 97110, 97530. If provider is comfortable, then all he or she needs to do is just submit the thing, or if he wants to change anything, he can do that as well. All right, so submitted successfully.